Namaskar. I am Dr. Pradyut Waghray, a pulmonologist and a critical care specialist, and also a member of the COVID task force. Today, our country is witnessing a huge, I will say, effect of the COVID pandemic in the form of a second wave. And this wave, unlike the first wave, is affecting many young people as such and increasing both the morbidity and the mortality, thereby putting a tremendous strain on the healthcare management of our country. So I would like to present briefly here a short overview of this COVID wave, second wave, and what steps we can do to manage it properly without rushing to the hospitals and overburdening the healthcare systems, and also what measures we can take to prevent from getting infected in this wave. These are the few symptoms that I have documented here, which COVID patients can present with. To mention a few, patients can present with throat pains or mild body pains, or they can have persistent dry cough, shortness of breath. Some people can present with fever, or which can be mild or severe, with or without chills. Some people are presenting with nausea, vomiting, or loose motions, or extreme body pains or muscle aches. And we have got some people who present with loss of smell or loss of taste. And even I have seen patients coming to me with just undiagnosed skin rashes and red eyes, which were mistaken for allergies, but they were actually found to be due to COVID. Now, if you divide this COVID spectrum, we can divide into three broad categories. That is the mild, which comprises 85%, moderate, which is comprising of 15%, about 10 to 15%, and just 5% of patients go into severe COVID. Now let us see what are these mild, moderate, and severe spectrum of COVID disease. In mild COVID disease, usually presents with just mild fever, low-grade fever, patient present with sore throat, cold cough, or they may come to you with loss of smell, taste, and loose stools. And most of the treatment of these mild cases they are managed at home. Simply stay isolated, thus avoiding other family members to get infected. What I do is I treat these patients with symptomatic management with good immune boosters comprising of vitamin C, 500 milligrams twice daily, zinc, 50 milligrams per day, and vitamin D, 60,000 units per week, which are good immune boosters. In addition, I use the pidotimod. Pidotimod is a drug with synthetic immunobooster, which increases our innate immunity and helps us to fight against this infection. I personally use doxycycline and ivermectin at this stage because enough trials are shown that ivermectin has prevented the progression of the disease from mild to moderate categories. The use of antivirals like favipiravir will be decided by your physician based on your severity of your symptoms. In addition to this, what I suggest is please do regular exercises like pranayama. There's very strong benefits of doing pranayama at this stage and at every stage of COVID. It not only increases your oxygen capacity of the lungs, but it also makes us more relaxed, avoiding the stress and panic associated with this disease pandemic. With this, in addition to the homeopathy and Ayurvedic, and this addition of these three systems of medicine provides a holistic approach to improving and preventing the progression of this mild case of COVID to go into the moderate stage. My one advice here is do not panic and get admitted to the hospital because the beds are required for other needy patients. And also do not rush and get your CT scans on day one itself. Your doctor will suggest you when to do the CT scan. The next category, we talk about the 12 to 15% of patients who belong to the moderate category. This is usually seen at the end of the first week or the beginning of the second week, where the fever persists and the patient's weakness increases. They present with extreme body pains and the loss of smell and taste continues. Here, the important thing is to see that we don't drop our oxygen saturations. And our oxygen saturation should be maintained more than 94, both at rest as well as after walking for 6 minutes, what we call in the medical terminology as 6-minute walk test. If for any reason you are not able to maintain oxygen saturation more than 94, don't panic. Simply by lying down on your stomach, what we call as prone position, your oxygenation will improve till you make arrangements for an oxygen cylinder at home. At this stage of the disease, we do some blood parameters like which are called as inflammatory markers like CRP, LDH, and ferritin. I want to stress one point here. I have seen many patients starting steroids from day one itself, which is not right because the viral multiplication occurs in the first 7 to 8 days. And if you give steroids at this time, that will increase and boom the viral multiplication. Steroids have a specific role in the beginning of the second week if the inflammatory markers like CRP, LDH, and ferritin are high, or if your CT scan is showing involvement, if you have severe breathlessness, or if your oxygen saturation is dropping to less than 94. Having done these investigations, we may continue with the favipiravir or doxycycline, ivermectin, and the immune boosters should continue. Pranayam should continue. Exercise should continue. A good, healthy diet and associated homeopathy, Ayurvedic helps should continue as we are doing in the mild cases. Very few people at this stage need again admission to hospital. Even moderate cases can be managed at home with at the most help of an oxygen cylinder or a concentrator. One important thing which you have to realize here is if you have associated comorbid conditions like diabetes or hypertension, etc., these need to be kept under control. And again, our aim is to see that we maintain the oxygen saturation more than 94 by proning, that is lying down on our stomach, or by the help of an oxygen cylinder. Having moved from this moderate, let us now see the severe category of disease, which is seen in only 5% of the patients. Here, the patients continue to drop their oxygen saturation. The blood values, which we have talked about, inflammatory markers show increased levels, and these patients definitely need hospital admission. And only at this stage, moderate to severe, to prevent the patients from going into moderate to severe, we need the help of remdesivir injections. So please don't panic and take remdesivir in the mild stage itself. Keep it reserved for those patients who really need it, who are going to get, who are progressing from moderate to the severe category. Your pulmonologist will decide which patient will need injection remdesivir and which patient will need an ICU care. So again, I request you not to panic and buy drugs and start these remdesivir drugs early on. And don't pressurize your physician to start them on these medications. We have talked briefly about the various categories of this COVID virus, but then it is mandatory as human beings that not only we should help ourselves, but also we should help our community. And this we can do by providing oximeters, because they are the one which actually monitor the drop in oxygen saturation. There are various, we can take the help of various social media, NGOs, voluntary organizations, and provide food, various groceries, vegetables, etc., at the doorstep of the patient. I want to stress here again that providing food or food itself will not cause the coronavirus to spread. So don't be afraid. Without coming in contact with the COVID patient, you can keep these foods and other eatables at the doorstep of the patient without coming in physical contact with the COVID patient. It is always mandatory for us. The government will do its job, but as a responsible Indian citizens, we have to take the help of various organizations and find support for arranging beds, oxygen, and other ancillary measures. At this stage of the pandemic, our thinking should be service above self and help as many as need. I have formed a short mnemonic here, SMSV. This is the most important part of my talk. If we want to prevent COVID infection, please avoid crowded areas. Don't go to crowded areas. Keep distance of at least 2 meters between the two of you so that the transmission of the virus reduces. This will make you to stay safe. Number 2, mask. Correct use of mask. I want to demonstrate here the correct use of mask because this is the correct use of wearing a mask. Your idea is you should cover the nose and the mouth both, because from here the virus will enter. Many times I see patients people walking on the road with a mask like this, which has no meaning, or the mask like this, because this part is open. So please cover both the nose as well as the mouth to prevent yourself spreading infection and to getting infected from others. So correct use of mask. The moment you come out of your home, please wear the mask correctly. Now, third component is the hand washing, because if the COVID falls on any objects and if we touch our eyes or nose with the hand without washing them, we are likely to infect ourselves. So frequent hand washing with plain soap and water for 20 seconds. If it is not there, you can take the help of a sanitizer. And the fourth and most important thing is vaccination. The government is doing its best to propagate vaccination. It is our responsibility to go ahead and take the vaccination at your nearest center. Please do not hesitate to take the vaccine. There are no absolute contraindications to take the vaccination except allergy to vaccination. All categories of people can take vaccination. So thank you so much. I think I have in brief conveyed about this COVID disease. We are here, our team is here to help you all. And then if anything is there, please you can get in touch with us and we can always help you in about this pandemic, in treatment of this pandemic. Thank you. Namaskar.